Hey, good morning, and thank you all so much for joining us. My name is Natalie Murdock in the State Senate representing South Durham and Chatham County, and honored to say that we are here for our second annual Black Maternal Health Advocacy Day here at the North Carolina General Assembly. So let's give it up for the second annual Advocacy Day, and you will see that we are joined not only by elected officials, advocates, also shout out to the women of Divine Nine that are here strong today, along with folks that are on the front lines doing this work every day. So why are we here today? Despite spending billions of dollars annually on maternal health care, the U.S. has the highest maternal mortality ratio in the developed world, and North Carolina ranks 30th of 50 states among the other states in the U.S. While most countries are achieving declines in maternal deaths, the U.S. is one of only 13 countries where maternal mortality is on the rise, and racial disparities are driving this crisis each day. Nationally, Black women are 3, if not 4 times more likely to die from pregnancy-related complications than white women. Here in North Carolina, Black women are 1.8 times more likely to die from childbirth. 2/3 of these deaths are preventable. We first filed the North Carolina MOMnibus in 2021. I wish I could say that our state is doing better, but we are doing worse. Our March of Dimes grade has gone from a D+ to a solid D. This was in 2023. We must and we can do better. That is why this short session we filed MOMnibus 2.5, and it expands the original MOMnibus, the implicit bias training for maternal health care providers, by adding training for maternal mental health care providers. We know that mental health is also something that truly impacts a birthing person's ability to raise their children, and we have $1.5 million slated in this bill for maternal mental health care providers. $1.5 million is included to establish a grant program for community-based organizations, some of which are represented here today, to expand prenatal education programs in rural, underserved, or low-wealth communities across North Carolina. Examples include birthing classes and lactation services. $2 million in recurring funds is included to support the training programs of community healthcare workers to provide education on the warning signs of complications after birth. You're going to hear some harrowing stories where the care provided after birth is also really critical. So we have asked for $5 million to be included just in this bill for short session. We are currently in session now. We can do this. We know our colleagues have bragged about $1 billion short plus, so I think they can find $5 million. Black moms and Black babies deserve better. This $5 million investment is simply a down payment. They deserve and need much more. We must invest state dollars to improve these outcomes, and we must pass legislation that directly addresses these issues and racial disparities and inequalities in maternal health. So you will hear today from speakers that are doing this work each and every day, along with moms that have some harrowing stories that should not happen in the U.S. Every birthing person and every child should have the opportunity to safely go home and be with their families. Next up, we will have Latasha Rose.
Thank you for the opportunity to speak to you today. My name is Latasha Rose, and I'm a birth and postpartum doula in the Triangle. And I want to tell you my experience of working with families in North Carolina. As a doula, I have learned that the best way to make impact is to keep your own stats. So I have done that, and I'm going to tell the collective stories of the families that I serve. All right, so most of the families that I serve, over 100 families in this area, are people of color. They are people who have experienced multiple losses. They are people who have not had dual support in the past or are having it for the first time. They are people who have had hypertension, diabetes, and were considered overweight a lot of times. I have seen the difference that doulas can make, even with having some challenges. And even when people come to you, the thing that they really need is the education. They need to have the education to make informed decisions about their care and to partner with healthcare providers. They need to have the resources that they need when they need them. They need to have mental health support. And a doula is a person that can help them to navigate all of that. So our stats are 24% C-section rate, Most of those were inductions, which is another story. 25% delivered with no pain medication, and most needed less pain medication than medical professionals are used to providing. A 98% breastfeeding initiation rate, and 90% still breastfeeding after 6 months. 100% reduction in anxiety, and that is what I hear from people most. They are afraid to go in the hospitals. They are afraid to go and receive care without someone that can help them, and that is why doulas are so important. All those numbers beat our national averages, beat our state averages, but what is a doula? A doula is a person who provides information, education, emotional support, and physical support before, during, and after childbirth. They are there to educate people about birthing options. They empower the families to make informed decisions. And they are also there to provide that hands-on support to show you how and not just tell you how. This support is already proven in studies. We don't need another study. It's been proven to reduce the likelihood of cesareans, as I said, to reduce the need for pain medication, to shorten labor, and to lower NICU admissions for babies, right? There are also economic benefits. So for the state of North Carolina, thinking about the number of cesareans that we do in this state and the number of NICU admissions and being reduced is a cost savings to the healthcare system. So being able to make sure that we provide life-saving measures and cost-saving measures is a no-brainer. My call to action is I urge you to pass the North Carolina MOMnibus Act and expand doula access to the families of North Carolina, especially the ones of color who need it most. By supporting this act, you will change the future for families of color, and help them to be more healthy. Yes. Thank you.
Good morning, everyone. Good morning. My name is Saran Wheeler. I am a practicing OBGYN, and I specialize in high-risk pregnancies. I am very grateful to be here, and I want to thank our state legislators, especially Senator Murdock, for this invitation to be a part of this critically important conversation. I'm also particularly honored to be here with so many leaders from the community that I and my colleagues are very privileged to serve. You've heard the statistics, and they're appalling. All too often, I have a front row seat to the impact of maternal health disparities on Black birthing people, their families, and the entire community. While the numbers are dismal, and there are times when the barriers seem insurmountable, I stand before you with so much hope. I have hope because I'm privileged to work with community organizations like the Diaper Bank of North Carolina, Mobilizing African American Mothers Through Empowerment, Equity Before Birth, and so many organizations that are represented here. And I have firsthand knowledge of the amount of community capacity that we have to draw upon. We don't always get it right, but my colleagues and I are working hard to be strong partners and to learn from the wealth of expertise that surrounds us. I'm hopeful because I interact with undergraduates, with medical students, resident physicians, and junior faculty who are completely unwilling to accept the status quo. They push me, my colleagues, our leadership to rethink the way that we provide care and what's possible. I'm hopeful because I have dedicated partners, including medical assistants, nurses, advanced practice providers, PhD researchers, and fellow physicians who come to work every single day, eager to provide outstanding care and to make innovative discoveries and earn our patients' trust. I'm also hopeful because I'm standing with state legislators who are fighting for the policy changes that we need to provide the care that our patients deserve. One of my favorite quotes is from Martin Luther King, and it says that the arc of the moral universe is long, but it bends towards justice. Our patients know better than anyone that the journey towards racial health equity and maternal health care has been long. And I share the sense of urgency that change is needed right now. One preventable maternal morbidity or mortality is far too many. But in our appropriate urgency for change now, I also hope that we can draw strengths from some of the important progress that we've made. We're nowhere near where we'd like to be, and yet every day I see stronger collaborations between medical professionals, patients, and their communities. I see Black patients and their families empowered to ask questions and demand high quality and respectful care. Another one of my favorite sayings is that the best predictor of future behavior is always past behavior. Ultimately, I wake up every day hopeful because I know what Black people and what our communities have done in the past. I know what we've endured, how we've supported one another, how we've made the best out of and made ways out of no way at all. I have hope, but it's evidence-based hope. In a future where health equity is realized, where all individuals, Black, brown, no matter what color under the rainbow, where all people can achieve their full potential of health, and the family that they desire in an environment where they are respected and valued. I urge this body to pass this critical legislation that gives us the tools that we need to realize this dream. Thank you.
Good morning. Good morning. My name is Dr. Charity Hawkins, and I typically am introducing myself as an assistant professor of social work at North Carolina Central University and a maternal health researcher at Duke University. However, today I'm standing before you as a Black mother. I want you to take a look at this picture. This was the first picture we took together as a family after giving birth to my first child, Margot, in February 2016. I had her after 40 weeks of pregnancy, 3 days in labor and delivery, and an unplanned cesarean delivery. I didn't picture this as how my baby girl would enter the world, but she was healthy and I was happy. You see, I was a doctoral student and approached my pregnancy with a level of seriousness no research project could ever receive. I initiated prenatal care as soon as I found out I was pregnant. My husband and I enrolled in birthing classes, read books on what to expect, and took extra care to ensure I ate well and exercised throughout my pregnancy. We asked questions during my OB visits, shared my family medical history, took notes on my progress, and joined online communities to learn from other expecting parents. Other than testing positive for gestational diabetes, which I was able to control through my diet, I had a healthy pregnancy. We were excited to welcome home our baby girl, but that was when life became complicated. No journal article or textbook prepared me for the physical and emotional pain I experienced the day after giving birth to Margot. With family members visiting our first child, their first niece, grandchild, and great-grandchild, I stood up from my chair and blood rushed from me. I can still hear the sound it made when it hit the tile floor. With my sister-in-law in the room holding my daughter as my husband held my hand, a doctor without much explanation or preparation, and definitely no pain medication, manually removed blood clots from my uterus. My father, who was just arriving to meet his granddaughter, heard my screams from the waiting area. Could you imagine that being how you find out your daughter recovering from pregnancy and delivery? Now I want you to look at this photo. This was taken by my husband just 2 short months after the first. I had just been diagnosed with peripartum cardiomyopathy, or pregnancy-related heart failure. My heart was functioning at only around 5 to 10% when I was finally diagnosed. Finally diagnosed. Finally, after communicating my symptoms to my OB at multiple visits. After rushing to the ER with classic heart attack symptoms, only to wait 5.5 hours in the waiting room. After finally receiving x-rays and a physical exam through campus health because of my doctoral student status, I finally knew what was happening to me. But why did it take so long? Why weren't my symptoms taken seriously? Why wasn't my doctoral education able to protect me? Why did my daughter almost lose her mom and my husband his wife? Why did we get so close to this picture not being possible. We are experiencing a crisis here. Improving the maternal health of Black women improves the health of all. We cannot afford to wait for action. Legislation like the MOMnibus Act is needed now. Our lives depend on it.
Thank you so much for those powerful, powerful words that you have heard. This is real. It is very real. And that's why I joined Senator Murdock and many others in supporting and sponsoring the MOMnibus Act. In 2019, I believe it was, we just thought racial bias, implicit bias was the issue. But when Senator Murdock was appointed, she said this is a much larger piece that we need to bring networks. And so I want to just thank her for her tenacious work in bringing together coalitions to make this happen. This is the dream of coalition that we know is going to help to move North Carolina in the right direction on this particular topic. I stand here today as a legislator from Durham, but I stand here as a dad, as a husband, and as a brother that I've watched my sisters struggle and not be listened to during the birthing process for my nieces and nephews. And I saw my wife go through multiple miscarriages and complications as we moved to expand our family. And we've heard these stories within our own communities over the years, but having it on paper, having it in legislation, and having communities go out and talk to legislators is where the rubber meets the road. And so a few pieces of work that have progressed. Of course, it is much moved, much past implicit bias, and now we're in our second, year of this advocacy opportunity. But there were some wins. We were able to get a few $100,000 for organizations like Equity Before Birth and MOMA in the last budget cycle. There's been major conversation with some leaders around, what doulas and the roles that doulas play. And so, as the doctor mentioned, there is evidence-based hope that there are people listening, because everybody is starting to hear and see these numbers over and over and ask the simple question: why are Black women doing worse in the maternal health space? And we know that implicit bias is real. There are those who somehow believe that we, take pain differently, that we don't need medication. But what it does boil down to is that in the medical space, we need to make sure that every doctor that wants to go into this space has the training to deal with all populations. Yes. Because again, the simple ignoring of someone's pain can lead to death. And again, I have sort of been close to that in, again, my own life. And it is something that I know, along with Senator Murdock and many others, that we hope to stop in North Carolina. This is an issue that this is not a partisan issue. This is not a partisan issue. So today's advocacy includes both Democrats and Republicans, talking to them about what it means to ensure that everybody has the right to bring and bear a family into this world in North Carolina. And so first, we have to acknowledge that this is a problem and make sure that we are putting those stats in their faces to make them make the right decisions, because if you know better, you do better. I would say the other piece is supporting the community-based organizations. Yes. I think, again, what was it? Maybe in 2022, like, there's a Black Maternal Health Conference. Yeah. Right? And it's like, well, she's like, no, I missed it this time. And so she spoke at the last one. And so it's just started to showcase that there were so many groups dedicated to this topics, Divine Nine and others. And so that's where the hope comes in, but that's where the work has to be done. We challenge, we both represent Duke Health Systems. Senator Merkel and I were with the president of that organization, and he asked what the question, and she said, Black maternal health, meeting with those organizations and validating that they know what they're doing because they're closest to the ground. And so a couple of those things are, again, we hope not only in legislation, but outside in our communities to make sure that we're funding, but bringing awareness and validation to the experiences that they bring. And then lastly, legislation is great, but money's better. And so, making sure that we ensure that they're listened to and that they're part of the conversation, but the funding so that they can continue to do the work of touching families who don't feel like they feel comfortable in normal health care setting, people that they know that look like them and care about them or are willing to listen to them is truly important. And so I do urge my colleagues to support this legislation and even the major parts of it, especially the funding parts, so that we can make sure that every person, Black or brown, that is experiencing issues in the healthcare system when trying to bring kids to bear can get the service that they deserve. And for me, this is, they say this is, with North Carolina's where the weak grow strong and the strong grow great. And bills like this, opportunities like this make us prove that. Yes. Either we're going to help the least of these and those who need help, or we're not, right? In order for us to be the state that's going to prosper and ensure that all of their citizens can, we have to do just this. I'll end with one dream that we have is an opportunity for more of our healthcare systems to invest in Black maternal health. There are lots of women's health centers across the state of North Carolina, but not one dedicated to Black and brown women. And with the crisis being what it is and the numbers being what they are, we know that the evolution of MOMnibus will somewhat take us there. But for right now, we want our legislators to look deeply at what we've offered to them and work with us to find even more resources with all the surplus that we have. And so thank you to the advocates that have come today. I stand with you. I will stand with you for the remainder of this time, and I really appreciate the support for this effort.
Good morning, everyone. Good morning. I'm Representative Amber Baker, District 72, Forsyth County, and I stand before you with an adjacent issue. I'm a daughter, a mommy of one, who desired more children, but because of fibroids, I was given no other option but to have a hysterectomy during my childbearing years. So the reason I stand for this fight is for all of my community nieces and nephews that are now being born, and for all of my Auntie Yaya babies, right? Because that is also a part of this discussion. Because as Black women, we are not listened to, nor are other options for preserving our uteruses, preserving our babies, are not part of our discussion. And so I stand here today in solidarity with all of my sisters and all of our advocates to say our voice matters. We're going to continue to advocate. We're going to continue to fight. And as demonstrated today, we know that Black women face disproportionately high rates of maternal mortality and morbidity compared to women of other races and ethnic groups. That's undeniable. That's not hyperbole. That's facts. These disparities persist across income. Income. Lord, I didn't think this was going to be hard. Because sometimes when you live in your pain for so long, we learn how to mute that pain so we can continue to move forward. And no woman should have to do that. Education levels are not solely explained by individual behaviors or medical risk factors. Instead, they are rooted in systematic inequalities, including racial bias, as we've heard today, and discrimination within the healthcare systems, which we also have continued to hear. So we will continue to bring forth efforts to address Black maternal health disparities and realize that it requires a multifaceted approach, as demonstrated here today. As my colleague, Representative Hawkins, said, legislation is great, but money to address this is better. We want to increase high quality prenatal care, but as my sister shared, that alone is not enough. She did all the right things. She checked all the right boxes. She read all the right books. She ate right. She did everything, including letting her OB know something in my body is not right. So checking the boxes is not enough. We have got to deal with competency around this issue. We have got to make it mandatory that any doctor, regardless of color, who is entering in this field, understand that when your patient comes to you about something in her body that you can neither see nor feel is not right, that you sit up straight and take attention. We have got to put in place those little books that they go to flip the pages to see what these symptoms might be, is ensured that every office have one of those. I went to four gynecologists until I finally found a Black woman who said, we can try some other things. We don't have to go immediately to removing your ovaries. 4. And it wasn't until I found a woman who looked like me, who listened, who understood that as an unwed woman, who one day wanted to be married and perhaps give my husband a child, was being denied that, because that meant a part of my womanhood was being taken. So what I'm saying here today is that organizers, mommies, policymakers, people who hold the purse strings, we must continue to shout loudly from the rooftops to ensure that our issues become everyone's issues.
Yes.
Because we know that as Black women in general, more specifically, and Black people in general, when we get better, everybody gets better. When we bring an issue to the forefront and pull the full weight of who we are as a collective, take on an issue, we understand that it will benefit all. So again, I stand today in solidarity. I am here to continue the fight, and I look forward to all the babies that will come forward, that Auntie Yaya will be able to hug and kiss those little cheeks and just cuddle them, because we know we're going to conquer this. And so again, I thank you, Senator, for allowing me to be a part of this. And as we talk about money, that's where I was. In appropriations, trying to get us some money, right? So I thank you, and we will continue the fight.
All right. As we close, just want to thank all of our advocates, all of the amazing birthing workers that are on the front lines each day, and would be remiss if we did not thank these moms for telling their stories. I honestly hate that you have to be in a position to tell those stories, but if you don't tell your story, no one will know your story. So as traumatic and as triggering as that may be, just cannot thank you enough for continuing to share your story. And do want to highlight, we have a few more legislators that have joined. We have Rep. Jones, Rep. Brown, Brown and Brown, and Rep. Price. So thank all of you. And as we mentioned, Rep. Hawkins luckily did mention some of the wins. Do also want to close with thanking my colleagues every time we do this. And I don't mean the Democratic colleagues either. My Republican colleagues, every time we do these, I always get a few calls. I always get a few text messages. Hey, saw you all. I saw your folks here today. Saw them in the hallway. So we mentioned when we first filed MOMnibus, we took it out of the bill before the full-on Medicaid expansion. Medicaid 12 months postpartum was expanded, but we can do even more than that. The Biden-Harris administration has provided funding for 24 months of postpartum coverage. So now that we have expanded Medicaid, that is something else that we can do as well. And as Rep. Hawkins mentioned, there has been some funding provided to support community-based organizations. We want more of that funding to go to DHHS so that these orgs can apply for that funding, along with private organizations like Duke University, who are directly funding Black doulas, to be specific. And also, as Rep. Baker mentioned as well, we are not knocking it out of the park, honestly, with any demographic. So if we address Black maternal health, since Black women are doing the worst, all women, their outcomes will improve if you address those that are having the most issues, because we're not hitting the mark, no matter who you are or what your race is or your background. We need to do much better. This is not only the U.S., but North Carolina. We represent the city of Medicine in Durham. We know we can do better. So with that, we will open up for some questions from press. All right. That was needed? Yes. Yes.
The billing contains implicit bias, and we've seen controversy over DEI. Can you just speak on that?
Yes, thank you. We will, and Rep. Hawkins, feel free to chime in as well. Full disclosure, we worked on this as a team. And so in 2019, Rep. Hawkins, Rep. Von Hafen, and some others came together and filed a bill around implicit bias in healthcare. And as you mentioned, unfortunately, we are in a space where folks don't want to acknowledge that race is a factor, but it is. So when we file MOMnibus, we will continue to remind folks that race not only plays a factor, we all have implicit bias. No matter what your field is, no matter what it is that you do, you come in, you are informed by your lived experiences. We see it with our colleagues every day as they work on legislation. They'll reference, my neighbor went through this, my sister went through this, my child went through this. So that informs your decision. So not only will we continue to put it in the legislation, there are medical providers that acknowledge it. They know that we need to have a more diverse workforce. We need to recruit early on, K through 12, of saying we need you to go into the medical field, no matter what that might be. Shout out to Director Jania Williams is here. We have funding in this bill for programs with HBCUs so that we can improve that pipeline. So not only implicit bias training, if we diversify that workforce, we know outcomes will improve. It's not just up to poor Dr. Willer at Duke University to hold up all of the women of color that want to have someone that looks like them when they go to have a child. She needs more assistance and enforcement. I think less than 3% of all OBGYNs nationally are Black women, let alone those of color is probably, I'm sure, less than 10. So we've got to do better around the board with the training, along with diversifying the medical workforce. And Rep. Hawkins, if you want to mention anything with implicit bias.
No. I think you knocked it out of the park as usual. The numbers don't lie. And that's really what it boils down to. And so one thing that we know is that you have to deal with demographics, and not demographics, but groups very intentionally. So if you see that one group is getting more sick than the other, one group is dying more than the other, the medical field the goal is to ensure that everyone is well, right? And so now that they have the data to prove that outcomes are not the same for African Americans and those of color, then they have an obligation to do that. So that has nothing to do with DEI and letting someone into a university or not having a specific program to make them feel welcome. This is life and death. And so that sort of is the piece. And I appreciate the question because the DEI conversation has dominated a lot, and we don't know where it will permeate next. But we're safe to say that when it becomes life and death, when it becomes data driven and we have a lot of momentum, that's not something that people in that space are going to go after. Again, because as Senator Murdock mentioned before I closes, in maternal health in general, in America, we're not knocking it out of the park. And so by making sure that we take care of each group, again, individually, based on what their needs are, individualized care, as you hear a lot about, we will not have to worry about this as a topic. And so again, it not only comes from legislation, but it comes from talking to medical providers, and it comes to talking to university health systems about the impact of their communities, and all of them are dedicated to it, and that supersedes any DEI craze that's going on around America. Thank you.
Can I add something to that? I would like to add to the DEI portion of what you asked, is that we must reclaim that power too. And so every conversation must continue to be linked to that, and we must not lay down and allow that conversation to fade to the background. So we will continue to be intentional about that. We will continue to fight against the forces that are trying to dismantle that, because it is such critical work and so important. So when we talk about implicit bias, that is the work of DEI. And we must continue to link that and reclaim that power, because there are forces that are fighting against that, and we won't go back, and we won't turn back.
All right, with that, we're going to wrap. But my LA right here, Devon Earth Dowd, we do have some handouts for press if you want some pull-asides or follow-up with individual interviews. And we do have some quotes highlighted from all the speakers. But thank you all again. And for our group, we're going to meet right out front for a photo. So thank you all.